So you're having a hard time memorizing, remembering muscles from origin, insertion, action, and you're trying to figure out how the hell to remember things? Well, then this video is for you. Hi, my name is Steph, the massage therapist, and welcome to another episode of Massage and Whatnot, where we talk about massage therapy from start to finish. And if you're ready, let's get started. So, hear me out. Because you're having a hard time memorizing those origin, insertion, and action, and innervation maybe, and you're struggling. I hear you. So these are my tips, okay? These are the things that you should be doing. First of all, learn your learning style. It might take you a while. Actually, there are some quizzes that you can take, but if you don't want to take those quizzes, here's what you can do. Imagine yourself in a classroom and, imagine your teacher and try to evaluate what method would you wish that your teacher would do so you can get the communication going and understand one way. Like, do you want to see things? Do you want to listen while you do something else? Do you want to read things? Figure this out. Again, it's going to take a long time. So if this doesn't work, skip to the next step. The next step is, second, group things together. Okay, I'm going to keep saying this, you really need to read. Unfortunately, reading is something you should be doing. It's good for the brain. I'm going to tell you that. So again, make it a habit of reading and try to notice the similarities and differences of each. You're going to notice that every region of the body has a similar origin or a common insertion, common action. I'm going to give you an example. Supraspinatus, infraspinatus, and teres minor. All of them has a common origin of the greater tubercle of the humerus. And you know what the funny thing is? The greater tubercle of the humerus, once a muscle is attached to that, the action, except supraspinatus, would do external rotation of the shoulder. Check it out. I bet you I'm correct. And then if a muscle is connected to the lesser tubercle of the humerus, most of them would be doing medial rotation or internal rotation of the shoulder, like subscapularis. Check. I'm sure it is. It is there. And you know how I know? Because I've read it and I checked the similarities and the differences. Because I noticed that in some positions, depending on where it is in the body, some common spots would give you the same action. Another example, your quadriceps muscle, rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. All of them has a common spot of the common patellar tendon via tibial tuberosity as an insertion. And the action is extension of the knee or kicking, right? And I'm correct. Check it out. Check your book. How did I notice that? Because I grouped all of these four muscles together. But Steph, origin are different. I know, but unfortunately, you can't change the origin. But because you know the common insertion point, instead of remembering origin, insertion, and action for each, you already compiled it into one. Learn it as a group, because if they have the same action, why learn it one by one? I mean, yeah, at some point it should be helpful, but you already know what it is. You know what I'm saying? Are you still with me when I say this? What I'm trying to say is group things together, because most of the muscles that are in our body are regionally grouped. We have a superficial layer that does, extension of the back. You know what I mean? Like, if it's in the back, like for example, whatever is in the front part of your arm, it's going to do flexion. Biceps, it's in the front part. It does flexion of the shoulder, flexion of the elbow. Your flexors in the forearm, it does flexion. Actually, if you want to learn more about that hack, you can go to one of my episodes about OSCE training. Specifically the first one, remedial exercises. I was talking about, I'm going to put it in the show notes also. But if you know regionally where the muscles are, where are they located, it's going to be easier for you to figure these things out. Okay, that's my number one method. Group things together. Find the similarities and the differences. And once you find the similarities, then obviously group them together. It's going to be easier to remember. Next, correlate it to your daily life. For example, erector spinae. I have what do you call this? I have an instructor. He taught me I love spaghetti. To remember that from lateral to medial, it's for erector spinae, it's going to be iliocostalis, then longissimus, then spinalis towards the spine. But before, when I was at school, I always forget it. So what I did is I said, instead of I love spaghetti, because I don't really like spaghetti a lot, I changed it to I love Stephanie. Right? I love Stephanie. Another example, you're maybe learning about, let's say, cranial nerves. Learn it through mnemonics. So, a common mnemonic, I know this is going to be rated PG or something, but it's O, to touch and feel. Very good. Vegetables. Aha. You know, it's actually the female reproductive area, but I don't like saying the word, so I changed it to vegetable. Again, to touch and feel. Very good. Vegetables. Aha. You know, and that's how I would remember the nerves. Okay, I know that's not the muscle, but that's a way. Mnemonics. You know, another example. We have I call it PSOIQ muscle. What's that? PSOIQ. What's PSOIQ? PSOIQ stands for the muscles of the hip that does external rotation. What are these muscles? P stands for piriformis. S stands for superior gemelli. PSOIQ. O is for obturator internus. I for inferior gemelli. And Q for quadratus femoris. I call them PSOIQ muscle, because that's how I remember it. Another example, the quads. Sometimes I forget the order of them. So I know them as the rec on the top, then limb in the bottom. Why? Why is rec on the top? Because rectus femoris is on the top. And if you take it out deep into rectus femoris, you're going to see LIM, meaning from lateral to medial, lateralis, intermedius, and medialis. Things like that. Another example. This is another example. Let's say scalenes. I use the Coca-Cola body for that. For example, you know, I don't know if you know this, but you know the Coca-Cola body where you would say 36, 24, 47. It's like the bust, the waist, and the hip size. I use that to remember my freaking scalenes. How? Your bust, the breasts. Where is it located? Anterior. So I'm going to connect that to my anterior scalene. So I'm going to say 36 because scalenes is what? It's connecting from the cervical 3 to 6, right? And then now the waist. The waist is technically in the middle. So now I'm going to correlate that to my middle scalenes. So middle scalenes would be 27. Waist 27. Why? Because middle scalenes originates at cervical 2 to 7. And now the hips, the buttocks, right? It's going to be 4 to 6 or 5 to 7 or 5 to 6, depending on which book you use. But I learned that posterior scalene is 5 to 7. So I'm going to stick with 5 to 7 or 4 to 6. So I'm going to say that the buttocks is 4 to 6. And I'm going to use that Coca-Cola body to remember the origins of my scalene. 36 for anterior scalenes, 27 for middle scalenes, and 4 to 6, 4 to 7, or 5 to 7, or whatever thing you have for scalenes for the thing. And how do I remember the insertion? Well, I remember that this lady that has a sexy body of 36, 27, and 4 to 6 has $112 in her pocket. Why? Because 112 signifies the insertion. Because what is the insertion of anterior scalene? Rib 1. What's the insertion of middle scalenes? Rib 1. What's the insertion of posterior scalene? Rib 2. See where this is going? You see where this is going? But That's just a couple of examples of how I correlate funny things or things about my life to memorize these muscles. So if you're not creative like that, then there's a lot of mnemonics online. Like seriously, you can find a lot of them. So try to correlate them in your life, right? Next are cue cards. Yes, yes, yes. You can keep writing cue cards, making cue cards. But there's a free app, Quizlet.com. By the way, this is not sponsored, but Quizlet. If you want to sponsor me, I would love that. But let's say Quizlet. You can make a free account and just type there origin, insertion, action of, lower limbs. Yeah, the terms are going to be a little bit different, but still anatomy is anatomy. It's not going to change that much. But what's the nice thing about it is because it's not just a cue card. It's a flashcard website or app that actually can create MCQ questions, short answered questions, matching type, and it actually has some features where you can, if you don't know the answer, they're going to keep repeating it so that if you remember, they're gonna not ask you that again. But if you don't remember, they're gonna keep asking you again. So I think instead of writing cue cards, lean into technology more because it's easy. You just need it's yes, technology can have a lot of a learning curve, but hear me out. It's a nice thing to have. It's simple. It's gonna be on your phone while maybe you're on your break, you're jogging. You can play around with it. So yeah. Another thing is 3D anatomy. For visual learners and even on my coaching calls, the 3D anatomy by Elsevier, I love it. If you have an iPad, that's the best thing to have. That's the reason why I got an iPad just for that app. I found it nice on an iPad. It's a 3D app explaining all the muscles, giving you origin, insertion, action, innervation, blood supply. What's the action? What's the synergist? Explanation of why is it called that way? The fascia around it. Can even pinpoint where exactly the origin, insertion, and action is, even the nerves and stuff. So if you're a visual learner, then I would totally invest in that. And I would comment it down below. Again, it's not sponsored, but I highly believe on that app. And the last but not the least, you can do the pen and paper method. Here's what I do. I pick 10 muscles. Okay, pick 10 muscles, get a piece of paper, and then quiz myself. Make a chart of origin, insertion, action. And I'm going to keep writing. Whatever I remember about that muscle. I'm going to keep writing that. Once I figure that out, I'm going to check if I got it and then check which one I got correct and then keep repeating. If I get the 5 wrong, I need to make sure that I remember that 5 and I keep repeating. If you want to keep writing and stuff like that. Another method is talking to yourself, like what I'm doing right now. I'm thinking that you're here with me, listening in with me and Milo. So what I'm saying is, you can keep repeating, you can keep talking. You know what I did before? Because I got so tired of just reading and watching videos. What I did is I went to the gym, put the treadmill on the very lowest setting, and then I kept talking to myself as if I'm teaching myself stuff. So, trapezius, it has 3 fibers, upper, then middle, then lower. All of these are correlated in the freaking SAC. What the hell is SAC? It's gonna be spine of the scapula, acromion, and a clavicle. And it does multiple things, blah, 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 so on and so forth. People looked at me weird, but I passed my exam using that method. Because again, sometimes reading and sitting down, it's not coming in here. It's not going in here. So find a way, I find that fun. First, I lost weight because I was trying to do some weight loss. At the same time, I learned something. Hit 2 birds with 1 stone. So what's my takeaway for this? It still goes back to finding how you learn the best. The tips and tricks I have given you are just examples of how you can make it easier for you to memorize. Practice makes perfect. That's number 1. But reading, learning, and actually paying attention to the actual substance or actual class on these things would be good. And by the way, I forgot to add it, but actually palpating it on your own body is good. Feeling the muscles is actually helpful to figure out where the muscles are located and correlating what you have read, what you have memorized and practiced, so on and so forth. Sorry, let me correct it. I don't like the word memorized. Familiarize things. It's like going to someone's house or a new place you've never been before. In the beginning, you're going to check the map, you're going to check GPS, you're going to follow their directions until you reach the place, until you realize that you need to keep coming back to that place. So what you do, the first few days, you're going to keep doing GPS. But then, because now you observed that, okay, you know what, at 3 p.m., it's going to be traffic at this road. Let me find another route. Let me find another way to remember that at 3 p.m., don't go to this street, go to the other street. Familiarize the surrounding, familiarize the neighboring muscles. Because yes, you maybe can't remember the actual muscle, but if you remember the neighboring ones, it can give you a clue of what they do. So for example, biceps. Biceps, if you take them out, we have coracobrachialis and brachialis. Try to imagine, where are they in the body? How many joints do they cross? Figure it out. Your body is your cheat sheet anyway. You're going to figure this one out. Once you find the best way for you to remember your origin, insertion, action, everything would make sense. Even learning the innervation. My technique, okay, this is how I learn it and this is how I coach some people. I tell them to learn origin, insertion, action first. Then once they're familiar where it is in the body, then learn the nerves next. Because, for example, if you know that all of these muscles at the back of your arm, or your posterior arm, is radial nerve, you're not going to add a lot of things to memorize because you already know all the muscles on the posterior side of your arm or the back side of your arm. So knowing the other parts like the radial nerve is easy peasy once you know the basics, once you get the similar things together and sort out the different ones. So again, there's a lot of ways. You just need to find the best one for you. Again, if you enjoyed this episode of Massage and Whatnot, do not forget to like, share, and subscribe my channel, Steph the Massage Therapist, because this is where you find this podcast. And again, visit my Spotify podcast also. I keep forgetting to say that. And if you have any questions, clarification, notifications, things you want to tell me, please follow or message me on Instagram at steph.palisok. It's going to be down there below. And I'm going to be there. I'm going to be answering your questions if I can answer them. I don't know everything, but I can give you everything if it's about massage and whatnot. Again, my name is Stephanie, the Massage Therapist. See you next episode. Bye.